When it comes to skin, discoloration of the skin is a big issue for all dark-skinned men and women, and it presents itself in many different ways, this hyperpigmentation. It can be a melasma, which is age-related. It can be just the hyperpigmentation that you get after acne. So one of the key priorities for us in Africa, at L'Oréal Africa, is provide a solution to hyperpigmentation on the continent. One of the big complaints about hair is hair length retention, hair loss basically. So it's about providing solutions through some of our brands like Mizani and Dark and Lovely to help in the strengthening of the hair, so it can be better retained. And also it's also about understanding the physiology of African hair.
Some observers say that the field of African skin and hair remains largely unexplored. What are your thoughts on that?
Absolutely. Even when you look at the number of dermatologists in Africa, they're significantly lower compared to any other continent. In some countries in Africa, did you know you have as little as 10 dermatologists for the entire country? We have a lot of questions yet to be answered because primarily we just don't have enough people asking the questions and doing the research. In fact, there is so much more to be done, not just in understanding African hair and skin physiology, which is where I'm currently working on with the grant, but also in the provision of scientifically backed products. So we identify this is the physiology of the African skin and hair. Then we go to the products that we offer. How can we ensure that it is effective on a scientific level?
Let's talk about one of the company's initiative, which is the Africa Hair and Skin Research Grant that has been ongoing for the past few years. L'Oréal just announced the winners for this year's edition. Tell us more about the grant and what it consists of.
The aims of the research grant is fourfold. The first fold is to foster scientific research on African hair and skin. Number two is to finance a one-year study in Africa by African scientists and clinicians. Number three is to support the researchers by providing visibility and connections in African hair and skin. And number four, which for me is very important, is to utilize the data generated by these scientists to build and to raise awareness for guidelines on hair and skin care.
Talk to us about this year's winners and what made their field of research unique.
We have 3 winners this year. They were chosen by a panel of 7 jurors led by Professor Anissa Moussam of the University of KwaZulu-Natal in Durban. The first winner is Professor Niamba from Burkina Faso. The second winner is Professor Raphael Noro from Madagascar. And the third winner is Dr. Kouassi from Ivory Coast. What really made them sort of stand out was the quality of the proposal that is submitted, on originality, on feasibility, on how interesting it is for the African continent as a whole. So the first winner is looking at keloids, the factors that increases the risk of keloids. Why is this important? Because keloid is very hard to treat. Keloid is a hypertrophic scar. It's very unsightly. Professor Rappelanoro's work in Madagascar is looking at atopic dermatitis, trying to understand the relationship, the correlation between genotype, phenotype, environmental, and the treatment responses for atopic dermatitis. And then thirdly, we have Dr. Kouassi in Ivory Coast doing a questionnaire study. And the questionnaire study addresses what are the risk factors that can make somebody more susceptible to acne. Any experts working on African hair and skin should continuously document what they see in the clinic, in the research world, so that we can learn more about our skin, so we can learn more about our hair. Because I do believe that it is with this documentation of the science of the physiology of African hair and skin that we will be able to provide and produce more targeted and effective solutions for the issues concerning our population.
Damilola Fajuyigbe, thank you so much for joining us today.
Thank you so much for having me.